Hello and good morning from Rockland with TVC 22. I'm your host, Thomas Stockting. Coming up on this week's programme, we take a look at the COVID-19 update in our region. We meet with Clarence-Rockland's new councillor. We get the opportunity to speak with Maison Interlude House about Women Abuse Prevention Month, the annual Warden's Banquet, and Recreational Pathway deal details are announced. Now, November marks Women Abuse Prevention Month, raising awareness and creating a time to empower and focus on the issues surrounding violence against women and gender-based violence. In Canada, gender-based violence is described as violence that is inflicted upon persons or a person due to their gender identity, gender expression, or perceived gender. It's essentially any form of abuse, assault, or harassment that can be linked back to dominant societal norms surrounding gender. Women Abuse Prevention Month is a time to hear stories and find resources, as education and awareness is the best way of reducing abuse against women within our society. To discuss the local situation and some of the preventative measures, we spoke to Linda Bissonnette, a supervisor at Maison Interlude House, about the first day of the 16 days against gender-based violence.
So this day kicks off the 16 days of activism against gender-based violence, which lasts right up until December 10th, which is Human Rights Day. So in those 16 days, we do campaigns to raise awareness. And on December 6th, what we have 3 different vigils in Prescott Russell. So we have Hawkesbury, we have Rockland, and we have Castleman, where we hold vigils. And we also, why is December 6th also is remembering those women who were victim of that tragic shooting at Polytechnique in Montreal. So that's why it's December 6th is the vigils are held in 3 different towns.
That's great. I mean, I hope as many people here listening can remember that date and mark it down in their calendars. I will most certainly make time to come down myself on the 6th. We can't talk about anything today without talking about really the true events and the big events that have affected all our lives in the last 18 to 24 months and how they have impacted every other element. It has the violence against women and gender-based violence has been labelled as a shadow pandemic, with others even calling it a pandemic that was just going under the radar pre-COVID as well. What have you noticed about the impact of COVID-19 on both the survivors of gender-based and violence against women here in our region, but also the impact it's had on your services and your ability to be able to help people in our region?
So when COVID first hit and everyone was put into their homes and you know, when we had those stay-at-home orders and whatnot, what happened is we were making the victims stay in their homes with the abusers, which caused an awful effect on these women and the children, right, who were witness to that. Children weren't even going to school. They didn't even have that period of respite at school because everybody was confined to their homes. So the violence became more serious. It became more complex. So we have more complex cases now because of that. And what's happening with the housing crisis is that even if women want to leave, and all of our shelters are in the area are full, unfortunately, what's happening is that these women don't even have a place to go. So even if they want to get out, where do they go? There's a housing crisis. All our shelters are already full. And that's what we're looking at now. That's what we're having to deal with now. So we're having to meet women like through the outreach services and give them tools to try and cope with what they're living with at home. The housing has to be addressed because no matter how much we give them emotional support and we can give them counseling and we can give them all those tools to cope with the violence that's going on, where are they going to go physically? And that right now is the biggest problem that our outreach workers are seeing, is that you have a feeling of helplessness. I mean, you feel the worker feels overwhelmed because she feels like she's not doing enough, but physically we do not have enough housing. And like I said, when we do have these apartments or whatever that are available, they can't even afford them.
Mm-hmm. Yeah, absolutely. Available housing is one thing, but affordable housing is definitely a big issue, something that the federal election, it was sort of pushed back onto the provincial elections, and I'm sure will be a big topic when we come into 2022 with the election just around the corner as well. You mentioned housing there, Linda. What are some of your other bigger concerns for the future?
Well, like I say, right now it is housing. It's getting them out of that situation because there's a 6-year wait for this housing, for affordable housing, first of all. So it's the effect, the damage that's happening right now with these women not being able to leave these abusive relationships, and the long-term effects that that's going to have psychologically, emotionally, physically, and on the children, our next generation. Like, they're being raised in violent homes and they can't get out. So what's our future look like with these kids? What's going to happen?
Absolutely. And when we look at some of the prevention methods and programs that could be put in place, where does the onus really come on? Because we hear a lot recently about the fact that you can't just use prevention measures and programs on those that are victims, because essentially that's victim shame. So where do we go here? Where do the prevention programs need to go? Is it within children? Is it families? Is it first responders? Who is it?
Everybody, right? Everybody, because this is everybody's problem. It's not just, like you say, victims. We have to be preventative. So we have to get into those schools. We have to make children aware, also raise awareness with children. The general public. We do webinars. Maison Interlude does webinars. We organize groups. And like I said, it's especially important to get into the schools. So that's what we're doing right now, that we're trying to reach out to everyone, not just the victims, right?
Mm-hmm, absolutely. And so you mentioned there about the webinars, getting into the schools and a couple of things like that. What else do you think could be done for us to really try and make these societal changes towards this kind of mentality that we have at the moment, and literally, unfortunately, an element of this culture where it seems that violence against women and gender-based violence is so unfortunately prevalent?
Well, everybody needs to speak out. You have to be an ally. You have to believe the person when, first of all, when they tell you. And the judgment that follows being a victim of violence, that's another thing. We have to stop that. We have to stop judging. We have to believe the person when they tell us that they're being victimized, that they're hurting. You believe them, and you have to make sure that that person knows that it's not their fault. So everybody has a role to play. You don't have to be a psychologist to give someone support. And most of the time, a woman who has support, and it's proven, a woman who has support will benefit more than a woman who has no support whatsoever. So it's society's responsibility to make sure that you're an ally in this, to help these women, to believe them, and to make sure that they know that it's not their fault and that they are not alone.
Well, you touched on it there, Linda. My last question will simply be for anyone out there listening, for even just someone like myself, a general passerby on the street, in people's lives. We've all got friends, we've all got family. What's something someone can do on a maybe daily basis that can maybe help someone in need?
Well, like I said, just reach out. Just let that person know. If you know that someone is living in a violent situation, just no judgment, but be there. Believe what they're saying, and just let them know that, first of all, it's not their fault and they're not alone in this. That is so important.
Well, Linda, thank you very much for your time. Speaking of reaching out, finally there, I'd just like to give you the platform there. How can people get in touch with yourself and with Maison Interlude House?
So our number is 1-800-461-1842. So that is you dial that number and you'll be able to we have a crisis line, and you'll be able to reach outreach services, the shelter, and administration and whatnot.
The 16 days that Linda was talking about there began on November 25th, so last Thursday. And make sure you keep an eye out online looking for the vigils, the 3 vigils that take place in our region on Monday, the 6th of December. Now, let's take a look at the local COVID-19 situation for our region. At the time of recording, there were 6 active cases in Prescott Russell, of which 1 was in Clarence-Rockland. As you can see, there's a decrease of 6 in the UCPR and 2 in Clarence-Rockland. Great news, heading in the right direction as we come into winter. Our 7-day rolling average is now at 2.2, with only 2 people in hospital throughout the Eastern Ontario Health Unit, one of which is in the ICU. 92% of people have now received 1 dose of the vaccine locally, with 88.8% at 2 doses. And there have also been nearly 6,000 third doses administered so far. And earlier this week, Dr. Paul Romeliotis, the medical officer for the EOHU, said that the younger, less vulnerable people will be eligible for their 3rd dose come the new year. Speaking of vaccinations, Health Canada has just approved the use of the Pfizer vaccine in children aged 5 to 11. As you can see from these pictures here, some young local people in our region receiving their doses. On Monday afternoon, Dr. Paul Romeliotis explained how parents and guardians can go about booking their appointment locally, as well as resources for parents and guardians who might still be hesitant.
We have now set up 36 clinics for 5 to 11 that are available on the booking system effective tomorrow morning, just the regular similar booking system that we had for adults. And they will be available again all through now through December 23rd. And these are approximately 3,000 appointments. In addition to that, we're also going to be adding more in December to again be able to have more. These will be distributed all over. They are by appointment, but there will be some limited walk-in as well. But we're encouraging people to come in because we have to configure the clinics accordingly. It takes a bit longer for children to be vaccinated, as you can imagine. You know, it's a different sort of context in a mass immunization clinic setup. The vaccines will also be available at participating pharmacists and primary care providers as well. And so there will be ample opportunity for that. The other thing that we're going to be doing is for 3 weekends in a row, we're going to be doing school-based clinics all over the East Ontario Health Unit area, which will be walk-ins only for our local EOHU residents in the 6 separate areas. They'll be all over Eastern Ontario. There'll be multiple school boards, but each of the clinics, regardless of the school board, all students can go in for those things. Again, those start on the weekend of December 4th and 5th, and they go for 3 weekends in a row, and we're going to be as needed moving forward. Communication is going out to parents as we speak through the school boards to let them know. And I know that as of tomorrow, our clinics that I talked to you about are now in the booking system. A few things I want to say. Obviously, this is a different approach right now because now we're vaccinating younger children. And I know that a lot of parents have a lot of questions. And so we have a very extensive website on our dedicated on our website to COVID vaccine related questions for children. There's a section of Ask Dr. Paul, which I as a pediatrician answer many questions from parents. We have sections on how to here they are. This is a sample of the questions. They're all on our website. How prepare a child for a vaccine. Again, it's a different context, so it's going to take a bit longer. It's different dynamics. When you're bringing your child, the 5 or 6-year-old is going to be intimidated, is going to be scared. So there are certain things that we need to do, talking to your child, preparing your child, pain management. We will have some special spray that's used in pediatric hospitals that will numb the pain right away. And so those are the type of things that we'll be dealing with and trying to make as much as possible our clinics as kid-friendly as possible to encourage and make it as comfortable an experience and a pleasant experience as possible for young children. We also have on our website, again, a multitude of resources. We have a section that we're also going to do a video on how to hold your child during vaccination. As a pediatrician, I can tell you that is very important, how you hold a child, how you comfort a child. You can do both at the same time to facilitate vaccinations. And so that is what I wanted to talk about and share with everybody. Again, I urge parents. I know that probably 50 to 60% of children, and by the way, in our area, we have about 15,000 children that are between 5 and 11 years of age that are eligible. And we're anticipating probably 50 to 60% of parents, are ready to go. There's about another 30% that have a lot of questions that are sort of what we call movable middle. And again, I urge them to go on our website, speak to their healthcare provider, get information from credible sources before they make their decision. I believe that this is going to be another way of increasing our community immunity, herd immunity, that will bring us one step closer to being able to remove restrictions and go as close as possible to normalcy sometime in the spring. But this is a step in the right direction.
Dr. Paul there speaking of the recent eligibility criteria opening up to 5 to 11-year-olds to go get vaccinated. As he said just there, if you're hesitant, don't hesitate. Go reach out to a professional, go find some credible sources to make an informed decision. Now, the annual Warden's Banquet for the United Counties of Prescott-Russell was held over the weekend, honouring current Warden and Mayor of the Township of Alfred-Plantagenet, Monsieur Stéphane Sarrazin. The 2021 edition of the event was held at the Knights of Columbus Hall in Alfred, giving Mr. Sarrazin's friends, family and colleagues the chance to honour the Warden after the event was cancelled last year due to the pandemic. Late Clarence-Rockland Mayor Monsieur Guy Desjardins and last year's Warden Mr. Pierre Leroux were both acknowledged during the evening, as Mrs. Cindy Anthony of the King Club of Russell was the recipient of the coveted J.P. St. Pierre Award due to her outstanding contributions for the community. During the banquet, the United Counties of Prescott-Russell also confirmed their intention to continue supporting the recreational pathway with a financial support of $540,000 to be given over the course of 10 years. The money will be used to ensure the successful transition of the pathway from Via Rail to the Prescott-Russell Recreational Trail Corporation and aid some of the costs in maintaining it. Warden Sarrazin said, "It is clear that we still have work to do before reaching a final agreement, but they're grateful for the trust and patience you, the trail users, are having with their efforts. They're pleased to be able to support the Trail Corporation and are confident that all the elements will be aligned to ensure the long-term sustainability of the trail." Last month, the City of Clarence-Rockland announced they had appointed Mr. Kyle Sear to fulfill the duties of Councillor of Ward 2 until the end of the current mandate next year. Mr. Sear was the councillor for Ward 5 in Clarence Creek between 2002 and 2009, and he had to hit the ground running, entering his role just before the budgetary deliberations for next year. Earlier this week, I spoke to Mr. Sear about the process of setting the 2022 municipal budget, where he had significantly different goals to some of his fellow councillors, as well as asking him whether we can expect to see his name on the ballot next election.
Yeah, I think it's our duty to bring it as low as possible as we can. We're coming out of a pandemic. People are hurting. And I think that was the point I was trying to make with my fellow colleagues. I'm lucky, I still have a job, but there's a lot of people there who don't. And and we're not out of it yet. We're not out of it yet. We're looking maybe at a new wave is hitting Australia, hitting England. We're not out of it yet. And I think we have the obligation to bring it down to the lowest possible rate we can. And again, what is that rate? I don't know. We're in a very good financial situation at the City of Clarence-Rockland, and I just thought that given that we were the council there before me were fiscally responsible, well, maybe we could put a little less in the reserve this year to be able to give taxpayers a bigger break this year, acknowledging the hardship that everybody's living through with a different degree caused by the pandemic. So you mentioned we're at 2.95, I think.
Yeah, I think that's what it was. The last declared one. Who knows what it's going to be? Obviously,
yeah,
when you guys come back and have a chat about it in a few days.
I think we're going to talk about it on Monday. But we'll definitely. I think we could squeeze the lemon again, and there's different schools of thought. Some politicians will say let's target inflation. Well, that's nice when inflation is normal. We're not in a normal inflationary year. I think inflation is up 4.2%. Given COVID, given as a result of COVID, with the gas, the supply chain shortages, the houses, the price of the houses, everything, all the collateral damage that COVID caused to the supply chain impacts inflation. So to come and say, well, let's do rate of inflation in a normal year, I'd say yes, 2-3%, but we can't go to 4. And like I mentioned before, I think, I know that, a lot of people are having hard times during this period and have lost their jobs. And will be, I think we have a duty to bring it down to what was, lowest rate possible. So we'll see where we end up on Monday. But again, I'm looking forward to the discussion. And at the end of the day, it's a council decision. And I think, I want to bring it down those we can. And like I mentioned, there are good reserves there. Council has been, past councils have been fiscally responsible and have put money aside. So I think it's time to maybe just take some of that money that's aside or put less in reserve this year. And then next year when things come back and, people get back on their feet, then we could look at, increasing that tax rate to what it really needs to be. But I don't think this year, this year is difficult, and we need to give everybody, a hand, or that helping hand they need to be able to get up and get going again.
Not being out of the pandemic yet, though, is there not obviously a risk that by not contributing as much to those reserves, the city puts themselves in a bit of a dangerous position that could lead to quite a high tax rate next year as well? Is it a gamble essentially either way?
You could see it that way. Next year is, we don't know, it's hard with the pandemic. Like next year we could be in a better situation and in a worse. So and next year there's another council, there's elections too coming next year, another whole new council, or maybe the same depending on the results. But I don't like looking down. I don't like 5-year plans. I don't like, because you can't anymore. And the pandemic had shown us that you can't. Let's plan for tomorrow, but not plan for next year. So, and COVID had taught us that, and we're gonna get out of it. And then once we get out of it, but like I said, we're lucky. There is money there. The reserves has been built up, and tough decisions have been made, and we have that flexibility to bring it down a bit more. So let's bring it down a bit more if possible, and if I can convince my colleagues, and from there, next year, maybe bring it up a bit, depending on where we are and the financial state of the city. And so many things change in a year now that it's hard to predict what will happen next year.
Just before letting you run, I think this is a nice introductory interview, gives people a lot of insight into you, but just over the next 12 months, obviously, whilst you're in before the next election comes out, what is it you're really hoping to try and accomplish? And I know you hinted at it and basically said it earlier, are we likely to see your name on the ballot sheet next year?
Well, it's getting out there and meeting people from, Ward 2. It's helping businesses, families, and that's where I'm pushing for a lower tax rate to get back on their feet from COVID. COVID, we talked about how the impact it had on families, but it also had a huge impact on businesses. So, doing what we can to help them. Community organizations. I'm part of a number of community organizations, and we haven't fundraised in the past 2 years. Our coffins are empty, and every month when we meet, either virtually or we just started in person, we still have those requests for funds. So as a councillor, I want to see what is possible for us to do to help these organizations. Can we give them a break on a hall rental? It's just $100, but it's $100 that they can use to give to somebody else in need. So that's, you know, it's what are the mechanisms I could put in place, or council could put in place rapidly to get businesses, citizens, and community organizations back on their feet. Mental health is something that's dear to my heart. I know it's not of municipal jurisdiction. However, I'd like to see more services for the people of Clarence-Rockland, be it, you know, a partnership with Valoris or a partnership with a community organization, you know, maybe just a building that we could, you know, rent out for them, because people are coming out again. COVID, people are magani, you know, they've and it's mental health month, and stats show it, you know, people are struggling. So what can we do as a council to get people back on their feet, get businesses back on their feet, and help the community organization continue helping others? So basically that's my goal for this year, and then come next year, we'll see.
Is that a yes or a no, Carl?
That's a yes, a big yes. It's not a secret, it's a big yes.
It's a big yes.
It's just to decide where, but yeah, it's a big yes.
You heard it there. Mr. Sears' name will be on the ballot, either locally in the rural area or in the urban area next year. So that's it for this week's edition of the programme. As ever, if you have a story within the community you think more light needs to be shined on, then contact us, contact me. We'd love to be able to share it. You can get in touch on the usual ways by calling the station and reaching me with extension number 4, or you can email nouvelle with an S at the end at tvc22.ca. But for now, it's good morning from me, it's good morning from the team here at TVC22, and we'll see you next weekend. Goodbye.